can be aggravated by stimulants, every once in a while caused by them, irritability, and the rebound effect. Do people know what the rebound effect is? The rebound effect is like a withdrawal effect that most stimulants have. It'd be like if you drank coffee every day. Excuse me, let's say you drank coffee every hour and you were in a class from 9 to 5 and every hour you had a cup of coffee. How would you feel about, if you stopped at 5, how would you feel at 7 o'clock? You feel irritated and just kind of edgy. That's what often happens to kids. The problem is it may help the teachers in school, but when at night you have to give them dinner, make sure they got their homework done and get them to bed, and they're going through this rebound effect. So a lot of times if they change the dose, that works. Stimulants work on dopamine. Dopamine, the neurotransmitters in the brain. One of the things that they found, remember I was telling you just in March, a couple months ago, they published the first follow-up study where they studied stimulants more than a year. And what they found is even after a year, the kids who took the stimulants were doing better, but after 3 years they weren't. They were doing worse functioning in school than students who didn't take the stimulants. They're not sure why. They don't know if it was a tolerance or something happened. They had lost 6 more pounds than kids that didn't take the stimulants, and they were 1 inch shorter after 3 years. And this was just published a couple months ago. And matter of fact, I was in Washington, D.C. speaking when this was published, and the Washington Post ran a big article in the news that felt that the pharmaceutical companies had covered this up because they'd kind of had this data for a couple years. But it's a pretty complicated thing. But the point is that medications really were developed for short-term use, not really long-term use. And now we're just starting to get the data, what happens if you take this for a long time. What are other side effects of medications? We talked about the weight loss, stomach pain, insomnia. Some of the longer ones, you can have problems sleeping. For adults, high blood pressure, heart rate. So for most adults, they are now recommending that you have an EKG before you take a stimulant. In Canada, they've been doing this for like 8 to 9 years. They require heart functioning test before you take a stimulant. The height suppression we talk about, and they've proven. This is the most common thing I see from parents. You know, it helps the kids in school sometimes, but they say, I don't really like this. And I say, why? Well, my child is like a zombie. They're not funny. They're kind of sedated. I kind of like the old kid, you know, it was funny and more spontaneous. Again, that may be the wrong medicine or the wrong dose. That might be adjusted. The adolescents kind of have a different spin on it. The adolescents often don't want to take it because they feel subdued. They want to be spontaneous. They want to be funny. They don't like feeling that. I remember adolescents telling me they didn't like it, even though it might have helped them in school. When I asked them why, they said, well, my friends don't want to hang out with me. They say I'm boring. The guys in the band said I wasn't, you know, playing as well. My girlfriend broke up with me. Some of the kids who play sports who try to take the stimulants feel like it slows them down too much. Some don't, so it really varies. Strattera, which is one of the newer medications that's given sometimes for more kind of over-focused type, was supposed to be a real breakthrough when it came out about 6 years ago. They took an antidepressant and they tried to make a 24-hour stimulant, but it wasn't as stimulating. Couple problems they found. First of all, it took about 10 days to 2 weeks to work. And most adults with ADD who this is prescribed to will frequently forget to take it every day. If you don't take it every day, it doesn't work. If you take a stimulant and you forget one day, it doesn't work, but the next day it works. The other thing, the most common side effect from Strattera was fatigue and tired, and adults that have inattentive ADD were kind of slower anyway. So we have some adults that take the Strattera, but it hasn't been as useful. It doesn't work on hyperactivity. It doesn't work on impulsivity. So it's really used more with adults or people that have bipolar and attention problems or things like that. Some of you may have heard a couple years ago when they came out with these black box warning on all the stimulants that they had of people that had sudden deaths from taking the stimulants. It's very rare, but they put it on there because it happens occasionally. And this is why they're kind of recommending heart functioning tests, especially for adults or if you have any family history of heart disease or so. Strattera, which builds up in your liver and kidney, now they're recommending liver functioning tests for that. So One of the things that we see now with college students across the street, a couple years ago we did a study with UCI to see what was happening. 20% of college students are using these medications to study. Maybe 5% of them have ADD. They call it the smart pill, just like we used to use no-dose or drink coffee all the time. The problem is some of them, because they know it's for kids, use too much of it. And they'll freebase it or snort it and inject it. And it can be lethal if it's done that way. And there's been a lot of media attention to that over the last 5 years. But a lot of college students use it to study now, and they get it in Mexico or get it from their friends. But we have psychiatrists, by the way, so we're not against medicine. And sometimes if you're in a bind, you're in a crisis, you do have to use it to kind of get a quick effect. If your kid's being kicked out of school or you're going to lose your job because you can't perform. This is what I think the biggest weakness is. And this is a test to see who's paying attention in that good beta state. This is a child's closet. Let's say this is a child's locker at school, because school's almost over, or adult's closet before and after they're on a medication, a stimulant. I want to see which one of you can see the difference first. This is a hard question. I always feel guilty doing this when I speak at a church. It's a trick question. There is no difference. The only difference is when you take the medicine. The biggest disadvantage of the medication is very few people stay on the medication for more than a couple years. The kids don't want to take it. They get side effects. The insurance company says you have to switch. And sooner or later, you stop taking the medicines,